Hello, I'm Dr.Suddhasattwa Sen, Senior Consultant, Surgical Gastroenterology, GI Oncology, Laparoscopy and Liver Transplant, presently associated with AMRI Dhakuria Hospitals, Ashok Nursing Home in Jodhpur Park and KDQ Center being my chamber. I was a former Senior Consultant with the Fortis Group of Hospitals, Director of Medica and Apollo Group of Hospitals. See, jaundice is when you have increased bilirubin in the blood. Now what happens is that this bilirubin is secreted from the liver. It comes down the bile duct, stores in the gallbladder and comes out. So jaundice can have primarily 2-3 types. One is called the hepatocellular, which is a medical jaundice. That is, these jaundice are because of the dysfunction inside or before the liver, that is the blood vessels supplying the liver. So these are medical jaundice. The second group is because of increased breakdown of the RBCs, that is the red blood cells, that can give rise to hemolytic anemia and jaundice. And the surgeons, we are concerned about something called the obstructive jaundice, where there is an obstruction in this entire passage, which can be an obstruction at the lower end of the bile duct. It can be inside the duodenum, inside the pancreas, like pancreatic cancer, bile duct cancer. It can be stones inside the bile duct. It can be a fistula with the gallbladder or surrounding organs. It can be a stricture. It can be post-operative. It can be anywhere in the biliary tree. It can be intrahepatic also. Now, once we have diagnosed jaundice, medical jaundice will be treated medically with rest, medicines, food habits. They are mostly hepatitis virus, etc. But majority of the surgical jaundice are because of tumors somewhere or stones. For stones, nowadays we would prefer to do an ERCP and take the stones out and put in a stent. The larger stones, multiple stones or recurrent stones may need a bypass for the bile duct so that the stone can come out through the bypass tract along with removal of the gallbladder, may be done open or may be done laparoscopic. Whereas the jaundice which are caused by the cancers, like we discussed, pancreatic cancer and other cancers, these have to be investigated, diagnosed. No, we do not need a biopsy always for a hepatobiliary cancer, because radiologists sometimes tells us the tumor markers may actually give an adjunctive support that these are cancers along with the symptoms. They need to be treated on case-to-case basis. If they are operable, the only option to cure that thing is to go for operation and take those tumors out and bypass the biliary tree so that the jaundice can gradually reduce. The symptoms of jaundice would be mostly itching of the body, along with yellowish discoloration, white stools because the bile doesn't reach the gut, and along with other complications.